My name is Amelia. I'm a public health educator at MaineGeneral Medical Center. This presentation will cover basic information on harm reduction, including the physical health risks associated with injection drug use. So, what are some health risks associated with substance use? There are a lot of health risks associated with substance use. In particular, the most health risks are involved in injection drug use. Injection drug use is when a person uses a needle and syringe injected with a cooked liquid substance into their body. They either inject the drug into their muscle, underneath their skin layers, or most often, they inject directly into their veins. The health risks associated with injection drug use all fall into three categories: either drug-related, technique-related, or hygiene-related. Because injection drug use involves directly injecting into the bloodstream, this creates a variety of moments where bacteria can enter the body. A few of the reasons could be related to contaminants in the water, for example, using tap water, stagnant or still water, or reusing water, to name a few. It's recommended that someone uses sterilized water when cooking drugs or preparing drugs. If sterilized water isn't available, it's recommended that you boil water on the stovetop to kill bacteria and allow that water to cool. However, don't use the water if it's been sitting out for a long period of time because it can grow more bacteria. Bacteria can also be transmitted when sharing works or using dirty works. The equipment, including the needles, cookers, even cottons, can all contain bacteria that can be potentially fatal if entered into the bloodstream. Lastly, bacteria can be transmitted from someone's skin, simply if their skin is dirty. This is why it's recommended that people use alcohol wipes or antiseptic on their skin prior to injection. These bacteria can enter the body and cause potentially fatal diseases and infections, like blood poisoning, which can be fatal, endocarditis of the heart, which can cause an infection in the heart valves and can cause a murmur, fever, and chest pain. It can also be fatal. Tetanus, which is when the tetanus bacteria is introduced into the bloodstream. This can also be fatal. However, there is a vaccine and boosters that you can receive. Lastly, there's flesh-eating virus, which is a bacterial infection where the bacteria literally bites at your flesh. It can cause symptoms like a rash and fever, and it can also be fatal. There are many other health complications associated with injection drug use, including reduced veins and abscesses, like large abscesses on injection sites. The most prominent health risks associated with injection drug use are currently hepatitis C and HIV transmission. The rates of hepatitis C are quite high due to injection drug use. The only 100% effective way to prevent Hep C or HIV transmission is to use new, sterile needles every time you inject. Flushing the needle with bleach and water can reduce the likelihood that you'll transmit, but is not 100% effective in killing hepatitis or HIV. When someone uses a substance, their decision-making process is altered. This can increase the likelihood to engage in risky sexual behaviors, perhaps resulting in increased sexually transmitted infections or unintended pregnancy. Providing education, condoms, sexual lubricant, and information about all forms of birth control is important to prevent unintended pregnancy and the spread of STIs among people who use injection drugs. Additionally, withdrawal symptoms can cause serious health complications that arise from using a substance for an extended period of time and then stopping using. Depressants like opioids, fentanyl, heroin, alcohol can have withdrawal symptoms like restlessness, muscle and bone pain, diarrhea, vomiting, sleep dysfunction, cold flashes, and severe drug cravings. Stimulants like cocaine, crack cocaine, prescription stimulants, or methamphetamine have withdrawal symptoms like severe drug cravings, fatigue, depression, and psychosis. So, what is a drug overdose? That's another health risk associated with drug use. Drug overdose is when too much of a substance reaches your organs and diminishes their functioning. This can include your brain and your heart. While other overdoses are defined as a substance overload on the body, including brain and other organs, the symptoms of overdose can differ depending on what substance you're using. All substances can lead to a fatal overdose, whether that's prescription opioids, heroin, fentanyl, methamphetamine, amphetamine, alcohol, or even acetaminophen. Symptoms of a depressant overdose are slow or irregular heartbeat, slowed breathing, snoring or gurgling, blue tint to the lips or skin, unconsciousness, and vomiting. When someone ingests a depressant, their body automatically slows down, meaning their breathing gets slower, their heart rate gets slower. And when someone takes too much of a substance, as an opioid, they can stop breathing. If someone stops breathing, their body will not have enough oxygen to perform and keep their brain alive. When the brain goes dead, it's imperative to restore the breathing so the person can stay alive. It's critical to respond to an opioid overdose with naloxone or Narcan, the intranasal form of naloxone. Naloxone will knock the opioids off the overdosing person's brain so that they are able to start breathing again. However, depending on the dosage and the amount of substances that were taken, the person may need additional doses of naloxone to stay alive. Symptoms of a stimulant overdose are fast or irregular heartbeat, fast breathing, nausea, vomiting, high temp, headache, paranoia, hypervigilance, enhanced sensory perception, and insomnia. These are certainly different than an opioid overdose. Stimulants amp up the person's body and mind, so if they take too much, their body can't control itself. Stimulant overdoses can result commonly in seizures or strokes. Mixing drugs is the biggest contributor to accidental overdose. Cocaine use is involved in about a third of Maine fentanyl and heroin deaths. So it's best to administer Narcan if you're unsure of what the person took. The Narcan will not help with a stimulant overdose. But if the person accidentally took opioids with stimulants, the Narcan will help with the opioids. So if you administer Narcan, it will knock off the opioids from the brain receptors and hopefully help the person restore breathing, even if they did take a stimulant as well. However, if the person is overdosing on just stimulants, it's important to provide a cool compress, stay with the person, and call 911 so they can receive proper medical attention.